In regards to the benefits, we know what bioidentical hormones are, we know why we need them, but what are the benefits? Why do I really want to take bioidentical hormones? Well, let me give you a few examples of what the hormones do, and then you could probably infer from that as to why you want to take them, what the benefits are. Let's talk about testosterone and growth hormone. Testosterone and growth hormone are what we call anabolic hormones. Anabolic describes the state of metabolism we were in when we were in our upper teens, early 20s. Anabolic metabolism is where you're burning fat, you're building muscle, you have exercise tolerance, meaning you exercise X, you get X plus 1 or X plus 2 out of it. You have drive, you have motivation, you have assertiveness. Well, as these hormones begin to go down as you age, you go from anabolic metabolism to what's called catabolic metabolism. And this is where most of us are in our 30s, 40s, and 50s. Catabolic metabolism is the exact opposite. This is where you have propensity to store fat. You're losing muscle strength, muscle mass, and muscle tone. You become exercise intolerant, meaning you have to exercise 10 times X just to get X. And you don't have the drive, the motivation, the assertiveness that you had when you were younger. That's why most of us give up on exercise when we're in our 30s, 40s, and 50s, because we're just not seeing the results. And we're losing that drive and that motivation. If you weighed 150 pounds when you were 18 and you weigh 150 pounds when you're 50, well, the difference is that when you're at 18, that 150 pounds, most of that was muscle. When you're 150 pounds when you're 50, most of that's fat. So it's a change in body composition. I kind of jokingly tell my patients I want them to gain 20 pounds, and they look at me like there's something wrong. But actually what I meant was I want them to lose 30 pounds of fat and put on 50 pounds of muscle. So the net gain is 20 pounds of muscle, but they're a leaner body mass. So they're down 2 or 3 dress sizes. So you get good exercise tolerance by taking the anabolic hormones. You get a good body composition. And when you're increasing muscle strength and muscle tone, well, what's the heart? The heart's a big muscle. So you're actually helping you protect yourself from heart disease as well. And these hormones do indeed help to burn fat. So that's one of the benefits of replacing the anabolic hormones, testosterone and growth hormone. Replacing thyroid, well, thyroid increases the metabolism of every cell in your body. So it helps to burn fat. Between the testosterone, growth hormone, and thyroid, I don't have anybody in my practice on a cholesterol medication. They don't need it. Their cholesterol is normalized, their triglycerides normalized, and pretty much everybody loses a significant amount of weight depending on where they were when they first came to see me. But more importantly, thyroid just gives you overall increase in energy. You think clearer, your mental cognition is much, much better, you have more energy to get throughout your day. I personally have been taking a compounded thyroid for 18 years. I'm 57 years old. I have 3 medical practices. I'm in graduate school. There's no way I could do all that at 57 years of age if I wasn't taking compounded thyroid. My triglyceride levels are 55, my blood sugar 76, so I'm getting all of the health benefits from taking the hormones. There's no way I could do that without those hormones at the age of 57. 2 other hormones, estrogen and progesterone. Estrogen and progesterone help to protect women from the 95% of things that kill them. Heart attack and stroke, osteoporosis, Alzheimer's type dementia, breast cancer, uterine cancer, osteoporosis again. Progesterone for women, it's women's antidepressant. It's their anti-anxiety hormone. They just feel better from it. For men, it's testosterone. Testosterone for men, that's our antidepressant. That's our anti-anxiety hormone. We just feel like $1 million on testosterone. Women feel like $1 million on progesterone. So those are a lot of the benefits. Plus, yeah, estrogen and progesterone do help to prevent and offset a lot of the uncomfortable issues that come with menopause, such as hot flashes, night sweats, and mood swings. And testosterone helps increase libido for both men and women. So the testosterone for men and women is our sex hormone. Men just need about 1,000 times more than women do, but women still need testosterone. They have muscle mass. They have hearts to protect. They have fat that they need to burn. And yes, women enjoy a good sex life as well when their testosterone is optimal. So those are just a few of the benefits with some of the hormones. But there are other hormones that give you just as good of benefits, such as increasing your immune system.